Hey, good evening, everyone. Welcome to our webinar on varicose veins treatment. My name is Vicky and I'm hosting the session. I'm joined this evening by our presenter, consultant vascular surgeon, Mr. Aaron Sweeney. This presentation will be followed by a question and answer session. If you'd like to ask a question, either during or after the presentation, please do so using the Q&A icon, which is at the bottom of your screen. This can be done with or without giving your name. Please note that this session is being recorded if you do provide your name. If you'd like to book your consultation, we'll provide contact details at the end of this session. I'll now hand over to Mr. Sweeney and you'll hear from me again shortly.
Hello everyone, thank you very much for joining us tonight. My name is Aaron Sweeney and I'm a vascular surgeon and I specialise in varicose vein treatments. I'm going to have a little overview of what we'll talk about. What we might just mention briefly, my experience, a little bit about what varicose veins are, the different types, and then a little chat about how the consultations occur, and then all the treatment options. We also have a patient testimonial, just to give you a little idea of what to expect. But the most important bit is that at the end we have a question and answers session. So when we do these webinars, many people have questions and it's often very interesting. And many people join us tonight with very specific questions, and I'm very happy to spend quite a long time answering them. So I'll try not to bore you too much with little bits and pieces. So that's me, qualified a while ago. I first saw a laser vein treatment after it came here from New York, and that was in the late 90s, 1999. It looked fabulous, and it's turned out to be quite good. Here we perform about 1,000 procedures a year, but I perform quite a lot more, and we perform the largest number of laser vein treatments in this hospital. To say it's the largest provider, people seem pretty happy with it, and it's more or less the only operation I do here. So the first thing, people sometimes are a bit confused about what varicose veins are. So if I tell you to think of your veins like a Christmas tree, you've one main vein that runs up the center of your leg. That's called your deep vein. And then there are hundreds of branches. Most of those branches are draining muscle. So there's a little bit of muscle surrounding the vein, and it gives a little squeeze so that everything goes up against gravity, back up to your heart to be pumped again. The troublesome veins are the ones that drain your skin, and they look like little blue shoelaces running all over the surface. Again, there are hundreds and hundreds of those, and each of them drains a very tiny amount of blood, maybe a teaspoon or so per minute. And because we have gone from walking on all four to standing up straight, certain veins, which used to be horizontal, suddenly become vertical, and they have real difficulty draining uphill into the main deep vein. They need a few little valves. Sometimes those valves stop working. There's only a few veins that cause most of this trouble. There are a few useless things we have: a gallbladder, an appendix, and one particular vein that runs down the inside of our thigh. We could do without them, but they keep surgeons very busy. When you have a varicose vein, they tend to swell a little bit. They're not always visible, so sometimes you can have a varicose vein running from your groin all the way down to your ankle, which can be 50 or 60 centimeters. And because it's a centimeter or so under the surface, you don't necessarily see it, but you can get quite a lot of the symptoms, and it can fool you a little bit. They're usually swollen and large. They usually feel a little bit bumpy. They often give people a bit of ache or a heavy leg. The first sign of a varicose vein is swelling, and then sometimes night cramps, and then finally some itchy or dry skin when your skin is just not happy with blood pooling around your ankle. So we talked, there's different types of thread veins, but if you think of that Christmas tree analogy, You have the very tiniest ones, which are kind of like the little pines on the at the end of the branches of a Christmas tree. They're generally treated with some sclerotherapy, which is an injection. It is a little difficult at times. It often takes many treatments to treat those, and they can be quite bruising. So although they are cosmetic, they do take a great deal of effort on both our part to make them work. There are slightly larger veins, which again, often just a little bit on the little bit easy to feel on the surface. They're generally not dangerous. They rarely cause any trouble. And again, you probably classify those as cosmetic. Grade 3 are the more juicy veins, and these often appear in the inside of people's thighs or even on the calf, but that's just the surface bit. There's normally a vein that's much larger sitting just under the surface that's feeding those veins. Grade 4 is when veins start to cause a bit of trouble. So you have those hundreds of little small veins draining your skin, and then one decides not to work. And not only does it not work, but it starts pouring blood back down your leg. So it kind of overwhelms the other veins. They're working overtime, trying their best to get the blood uphill. So initially it starts as swelling, then the skin becomes quite unhappy, so it starts to get itchy. And then finally the skin gets really annoyed and starts to scar. And that sometimes appears as red or sore skin. Other times it starts to get itchy. But either way, it's a sign that things have moved on a little bit from just a little bit of swelling. So grade 4 is when the skin starts to get a little bit sore or changes color. And I think I'm going to show you a little bit more now. Yeah, we'll move quickly. If skin is left inflamed, eventually you can end up with an ulcer. But I would say that that takes ages to happen. Many people who've had an ulcer realize that in retrospect, their skin was a little sore, a little itchy. They thought it was eczema. They weren't quite sure what was going on. And then finally, a minor little bit of trauma occurred. And then next thing, they have an ulcer, which lasts for many, many months. Move on through that. So when you come and see me, I like to see you myself. And I do a duplex ultrasound scan of your veins in clinic. I think using an ultrasound is a bit like doctors using a stethoscope. It's always attached to my hand, and I think it's wonderful because it allows me to see everything inside your leg, and so you don't have to guess. In the olden days, when people were stripping veins, they just guessed where they came from, and that's the reason why it was pretty hit and miss as to whether you had a good operation or a bad operation. When you see me, I tell you all the different options available to you, not just EVLT. There are other things that we can do. And if you think you might want to have something done, we send you for an assessment straight away. So that's really checking your blood pressure and double checking that I haven't missed anything. And then finally, we send you, or you head off home. And then at some stage later, we give you a call just to see what you think. We deliberately try not to pressure you, so you can I think it's much easier if you get a phone call a few days later, you can then say yes or no, or I'm going to have a think about things. So very, very few people ever book in a date straight away. Most of the surgery is done as a day case. It's a walk-in, walk-out procedure. It's a little bit like going to the dentist, I think. It's about as stressful as that because you start to think I'm going to hurt you. And then normally within about 2 minutes of me starting to do anything to you, you relax a little bit. And I think most people tell me it's nothing close to a bad day at the dentist. So most treatment I do under local anesthetic. Doesn't mean that they all have to be under local. And plenty of people say, I'd rather be asleep. That's fine. Almost everyone who comes with a varicose vein can have endovenous laser treatment or one of the minimally invasive techniques. I almost never strip veins. I cannot recall the last time I've done that. It might have been 20 odd years ago. So most people have a small little laser put in and they walk in. If somebody is with them, The total time in the hospital is about an hour and a half. The total time for any varicose vein treatment is about 20 minutes, maybe 30 minutes. So it's a relatively quick procedure and pretty efficient. We don't have people hanging around all day. So this is just a kind of an idea of what endovenous laser treatment is. So the picture is a little bit confusing maybe, but think of it as the inside of somebody's right leg. So what you have is the main artery and vein running down the groin right the way towards the knee. And the main troublesome vein runs from the groin right the way to the knee. And what you see there is us threading up a little catheter up the inside. I call it a wire. So think of it as a wire being threaded up the inside of a vein. We use an ultrasound always to make sure we're in the correct spot. It's usually, after doing so many, it's a fairly straightforward procedure. So sometimes people say, well, when I look at the internet, I can find loads of different treatments. So I tell you there are really three. One is stripping veins, which has long ago been found to be substandard. And then the two main treatments that are available are endothermal ablation and chemical ablation, which are nice words for heat and some chemical being injected into your vein. The heat treatment is you thread the laser up or wire up the inside of your vein. You laser the inside lining of the vein, which is a fancy way of burning something. You try your best not to damage anything else. And when you damage just the inside of the vein, your body is amazing at working out that the vein suddenly is not working and it dissolves it. And that dissolving process takes about 6 weeks or so. And you kind of know about it for the first week or two because it feels like you have exercised too much or pulled a muscle. It's rarely completely pain-free, but it's usually pretty manageable. Most people walk the dog, for example, the next day. There are a few different types of treatment. So EVLT is endovenous laser treatment. So that's endovenous within a vein laser treatment. There's a treatment called radiofrequency ablation, which is just as good, but that uses electricity as opposed to a laser. And again, good treatment. The chemical techniques usually involve injecting something, and that's foam sclerotherapy is the commonest thing. So any of you can remember watching those old Mr. Muscle ads where the foam goes around the U-bend in the kitchen sink. I think people got a bit of an idea from that because foam sclerotherapy is just that. You make a bit of foam up, you inject it into a vein, it kind of pushes all the blood out, and then you get the chemical sitting right up against the wall of the vein and giving it a chemical burn. There's another machine called Claravane, which kind of combines the two. And then some people have even injected superglue up the inside of veins. We don't do that here. And for the most part, we do EVLT alone. And that's because we think it's quite good. People seem pretty happy with it. And more importantly, it is very safe. Foam sclerotherapy often produces some marks on the leg and can be a bit lumpy afterwards. And so, although we do use that, our preferred first treatment choice is with a laser. So that's just kind of a pretty simple leg. So that's left leg. If you look at the before picture, that's a few veins on the inside of the calf. That's the normal thing that people come to see us with. And if you remember what I said earlier, there's a vein running down the inside of the thigh usually. That one's not working. You can't see it, but it's a branch of that vein that comes up on the surface. So we pop a laser up that. If you don't bother removing any of the little veins, and if you do little incisions called phlebectomies. But if you didn't do that, what happens normally is the vein of the thigh disappears. That kind of turns off the tap and reduces the pressure in those veins in your calf. And then a few weeks later, they're normally quite reduced. And then about 6 weeks later, looks okay. If you look carefully, you sometimes see a few blue things. So that's kind of a reasonable outcome. And many people just want that because they want a pretty no-nonsense treatment with minimal complications and aren't particularly fussed about getting rid of every single vein. So I hope just to summarize that, your veins, think of them as a Christmas tree. Almost every one is perfect. You'll just have one or two things that are just branches that are not working correctly. They're pretty standard. There's the one that comes from your top of your groin and another one that comes from the back of your knee. Sometimes people say, oh, they must be important if they're big. Nope, they're big because they're not working. Others say, well, if I have that done, won't the blood find a different way to get up your leg? The answer to that is, well, actually, it's already done that. And if you think varicose veins, they're not only not doing their job, they're doing the complete opposite. So often, instead of draining a teaspoon a minute uphill, they're sending back down a cupful or more. And that's what overwhelms the other veins. So when you get rid of the vein, in fact, all the other veins in your leg have a bit of a holiday because they only have to do their own job. Sometimes people say, well, if you have your veins done, won't they always come back? No, the recurrence rate's pretty tiny following laser treatment. It's about 1%. That sounds amazing, and you can massage those figures depending on how super honest you are. When you laser a vein, that's it, it's gone. It's very unlikely to return. What people sometimes really want to know is, if I have a vein operation, how likely am I to be back? Well, about 1% of people come back within a year to 18 months. It's normally a small little vein nearby that's appeared, and that can be treated relatively easily. And depending on your age, if you come to me as a 20-year-old with varicose veins, I think even if I do a fab job, you still have about a 10% chance of another vein appearing. That's usually on the other leg. And it depends how you classify that. Many would say it's just a new vein, others would say it's a recurrent vein. But to you, what it means is you can come back or might need to come back and have another thing done years down the line. That contrasts hugely with stripping, where 50% of people had a recurrence. That was because when you pull that vein out, your body tries to heal the trauma caused. And in that healing process, loads of new veins appear. And if any of those new veins reconnect with the deeper vein or the central tree trunk, then you get new veins. So that's why people were told years ago, oh, don't have any veins done before you have your family because they just come back. And that's kind of slightly true. If you had a particularly brutal operation done and everything joins back and then you get pregnant, all of a sudden you get loads more veins. So there is some truth, but that is one of the nicest things about most of these minimally invasive treatments. They tend to have very low recurrence rates and very low complication rates. It's not zero, but it's pretty close to that. And most people walk in, walk out, 2 weeks later have forgotten about their operation until they look down at their leg and see it's still bruised. And I think it takes about 6 to 8 weeks for you to look down and think that your leg is actually sorted. The next thing we're going to do is just give a little bit about some patient experience, just to stop me talking for too long.
My name's Jo Crossy. I'm 58 years old. Well, it was making my legs more uncomfortable as the years went on, feeling very heavy and tired, especially in the hot weather. My feet would swell, and just generally feeling achy most of the time. I did start working part-time, and part of that reason was probably unconsciously thinking, actually, I can't keep on my feet all day long, every day. We thought it was worth the drive to go, and especially when it was a beautifully new hospital. It was a very pleasant experience, and I wouldn't hesitate to go back again if I needed to in the future. My GP referred me on the 22nd of January, and I had my consultation with Bennington on the 31st of January, so I was quite impressed by that. The operation was very straightforward. You are given a booklet to explain what the procedure is. Mr. Challoner, who I saw, also talked me through it, but obviously when you're in consultation it's a lot of information to take in. So I came home and read the leaflet. I also looked online for him, and he did a very good explanation online. Everything that was in the booklet is exactly what happened on the day. You were talked through it, and the staff were very helpful, supportive, and talked you through every process. I felt as if walking into a lovely environment like that everything was going to be okay, that it would be state-of-the-art technology and processes, so I felt very confident that I was in good hands. My recovery was, again, like it said on the tin, you know, I had to wear my bandages for 5 days and then take those off. I couldn't drive for 5 days, obviously, because they say for insurance purposes, if I had to stop quickly or if I was in an accident, insurance might not be so happy if I was wearing bandages. And then I was back to work in a week. It was a bit achy and a bit sore, but they give you advice about putting your feet up whenever you can, putting in local anaesthetics, rubbing in local anaesthetic gels, wearing a support bandage if I needed to, and I did that a few times because the weather was quite warm post surgery, so I made use of those devices and advice, and it certainly helped. My life now has changed in that I'm not feeling the heaviness in my legs, and I have been wearing shorts out and about, which I hadn't done before, so it's certainly boosted my confidence in terms of that. And yes, getting back to running after 2 grandchildren. If anybody was thinking about having their varicose veins done, I would recommend the Benenden Hospital. Their technology and the processes they do it's just laser treatment is the way forward in terms of not making you lie in a bed, getting you up and getting you mobile. Certainly Benenden Hospital is highly recommended as far as I'm concerned.
Thank you very much, Mr. Sweeney, for that very interesting presentation. So we're now going to take some questions. So we've got quite a bit of time, so please do ask your questions using the icon at the bottom of your screen. So first up tonight is Julie, and Julie says, many thanks for the session tonight. Is there a limit as to how many times you can have treatment, particularly sclerotherapy?
I would say sclerotherapy is usually a cosmetic treatment for smaller thread veins, and I would say that it always takes multiple treatments to get rid of thread veins. So sometimes people come to me and they think maybe it'll just be one session. That's very unusual. So I always caution people that thread vein treatment or cosmetic thread vein treatment is often a pretty long process that takes multiple separate treatment sessions. What you might say though is if I came back 2 or 3 years later for an MOT, can I keep on having that done? Yes, you can. With regards to varicose veins, well, it depends. Usually when the operation is done correctly the first time, you're rarely back. But if you come back, I scan you to make sure that the big vein, the deep vein, is normal. Once that's normal, you can get rid of all the other veins. It's very rare for people, though, to have more than 2 or 3 separate operations on varicose veins on one leg. That used to happen. It doesn't really happen that much anymore. So sclerotherapy, yeah, you can have multiple sessions, and I caution you, you often need multiple sessions. So it can be quite, I tell people it's a bit like watching paint dry, having thread veins treated. It takes multiple treatments, and there is a cost implication because of that.
Okay, lovely, thank you, Julie. I hope that's helpful. Next up is from Stephen. Stephen asks, would you treat both legs on the same day?
Not usually, actually, and there's a reason for that. In terms of complications from varicose vein surgery, there aren't that many. There's only one that I ever get concerned about, and that's a thing called a deep vein thrombosis. So that can occur after any procedure. It can certainly occur after a dose of COVID. And for example, your risk of getting a DVT, which is a clot in the big vein in your leg, it's about 1 per 100 pregnancies. Or if you break your leg skiing, it's 1 in 10 people get a DVT. With varicose vein surgery, it's pretty rare, but it's not 0. So I quote you a risk of around about 1 in 1,000. But that is extremely low when we do one leg at a time. And I think that's to do with mobility after the procedure. Some people choose to have both sides done. I just tell them there's a slightly higher DVT risk. Secondly, if I do it under local anesthetic, there's a limit on how much local anesthetic I can give you in one day. And whilst I can do one leg with ease, sometimes if your legs are a little bit complicated, I advise you not to have both on the same day, because I probably won't have enough local anesthetic to do it. If you have a general anesthetic, yeah, you can have both sides done, but 95 or more % of people choose a local anesthetic. So to answer your question, you can have both sides done on the same day, but nearly always I do it one leg at a time.
Okay, thank you, Stephen. I hope that's answered your question. Next up, we've got an anonymous attendee, and they've asked, I'm due to go on holiday in 7 weeks and would like to get my veins done beforehand. Would it be possible to recover in time and have my legs on show?
It depends. So for that, to answer that, nearly always I tell people that they can go away whenever they like. Plenty of people fly in and see me and fly out back to where they came from the next day. There's no particular risk associated with flying and DVTs. So from a medical point of view, you could have some done and go on holiday, I suggest, a few days later. The slight problem you have is that your leg will be bruised and a bit sore. I did actually work out that it's a mile of walking from Gatwick car park to the terminal. So that's a bit tough with a bandage on your leg. I think if you wait till the bandage is gone, you probably get to a week or two, your leg looks quite bruised. So most people don't go for a swim in a local pool for the first 2 weeks because they're a little embarrassed by bruising. That's usually gone at about 3 weeks. So I think you could pass your leg off as a normal leg 3 weeks after having something done. Again, I'd caution you about going on holidays because you'll be a little sore. You get a bit worried that you've ruined everyone else's holiday, that you're going to be hobbling. So I would say 3 weeks is the quickest I'd go on a proper family holiday after having my veins done. I think when you get to 6 weeks, nearly always you can pass it off as a normal leg and you don't have to explain to everyone what you've had done a few weeks before. So I think 6 weeks, most people wouldn't know you've had anything done. For people who are getting married, I normally say to them at least 12 weeks, because I know at 6 weeks everything will be fine, and then you don't have any panicking and you have 6 weeks beforehand where nobody worries. But yes, the answer to your question is yes, you could have it done whenever you like. It just depends whether you want to spend your holiday telling people that you've had your veins done. That'll be the first 3 weeks. I think if you wait a little longer than that, you'd probably be fine. But in terms of bruising and marks, I think it takes quite a few weeks, as in about 6, before you could pass that leg off as a normal leg and nobody would give you a second glance.
Thank you. Would the heat affect the veins at all once they've been done?
No, I think no. I think it's fine. And people worry often about DVTs on airplanes. If I tell you your risk of a DVT on a plane is 1 per million flights, it is a lot less than you think. And I, for example, don't wear flight socks, and the reason is that I think poorly fitting flight socks are far more troublesome than if you didn't wear them at all. And if I was going to America, I might wear flight socks just to stop my ankles swelling, because everyone's ankles swell when you sit in a plane for a long time. But they're not compulsory, and I think the risk to you of a DVT on a plane is really very, very small.
Okay, lovely. I hope that's answered your question, and enjoy your holidays wherever you're going. Next is from Marion, and Marion asks, do you have to be referred by a GP?
No, I kind of feel if you manage to get to see your GP, that's great. But oftentimes people are quite frustrated. I have absolutely no problem with people just turning up without ever seeing a GP. I think most people are able to diagnose a varicose vein just by looking at their own legs. And I don't think they need a formal referral for that. Some of your insurance companies, if you're insured, like you to have at least discussed it with them and an online GP consultation. But to be honest, I think many NHS GPs are a bit working a bit hard at the moment, and sometimes they put veins as a very low priority. Varicose veins are very low priority in the NHS. I think that's normally people who've never had varicose vein problems think of them as purely cosmetic. I would say to you that almost everyone I operate on has a problem with a varicose vein. In the normal course of events, people have them for maybe 10 years. And it's usually people who have other things to deal with, life, family, whatever. They don't want to be taking time off to fix their own legs. But it's often about 10 years, and then something happens like eczema or pain or a bit of phlebitis or something troublesome. That's the usual reason why people pop along. I don't think you need a GP referral to tell you that your veins are giving you a lot of grief. It's usually pretty obvious, and I'm happy with that.
Okay, hope that helpful, Marion. I think we've covered this already, but might be worth asking again. From Fraser, would you recommend awaiting after having a family or having it done before?
I'd have it done before. The reason is you might ask yourself, why do veins give you, ladies in particular, a load of grief? The answer is you, unfortunately or fortunately, have a hormone called progesterone. Progesterone gets really high just before a baby is delivered. Progesterone, amongst other things, it dilates things to allow a baby to pop out. It also dilates your veins. That's why if you have varicose veins, your last trimester tends to be a bit miserable because you've got a very high level of progesterone, everything's dilated, and your legs are just full of veins. Once the baby comes, the progesterone level drops down and your veins can reduce dramatically or sometimes stay. But to answer your question, if you have varicose veins and you're thinking of having a family, I would have them treated first, because then you don't have all this trouble with big dilated veins. And I think I don't want to repeat myself, but previously when people had their veins stripped, sometimes the pregnancy then induced loads of new veins, which was a definite problem. But I think that's kind of 20 years out of date. Nowadays, I would say to people, just get rid of your vein. There's absolutely no reason to wait 10 years, have 3 kids, and go through 3 miserable pregnancies when you could have been sorted relatively easily beforehand.
Okay, thank you, Fraser. I hope that's helpful for you. Next up, another anonymous question. Thank you so much for this seminar. Thank you for attending. I had a sclerotherapy done last year, which was very successful. 2 weeks ago, I had breast cosmetic surgery under general anaesthetic. I've noticed that my vein, which is treated, has come back. Any explanation for this?
Well, it depends. So I would say depends what you're having sclerotherapy for. So if it's for large veins and it comes back, well, it hasn't fully occluded the vein. If it's for thread veins, just to say, sclerotherapy for thread veins, you do get rid of the veins that you actually treat. However, if you are prone to thread veins, they'll always recur. So you will always require multiple treatments. But I'm not 100% sure what your vein was like beforehand. If it was a large vein treated with, for example, foam, that is a slightly higher recurrence rate than lasering and doing small phlebectomies. But I can't think of an obvious reason why it should pop back after another operation. I'm not sure of that.
Thank you. Next question. I'm 77-year-old, finding more and more veins occurring in the groin. My left leg has the most obvious vein shown in the calf. Would your surgery help this?
Maybe it depends. If you've had an operation before, you might require some additional procedures. So it's difficult to tell you, but when veins appear in the groin and you've never had an operation before, quite often you've another underlying vein just sitting underneath. That's the source of everything.
Thank you. Next question. I do a lot of exercise, running, spinning, 90-minute walks. If I have EVLT, how long until I can get back to these activities?
For most people, I tell them you'll walk the dog the next day. You will go to a spinning class perhaps 2 weeks after you have it done. You won't be as good as you were beforehand. And if you run on tarmac, I think it takes about 3 weeks to feel happy to go out for a proper run. So people who do lots of cycling tell me that at 2 weeks they felt happy enough to go out, but they certainly weren't at full speed. I think it takes 3 or 4 weeks following a procedure for you to be back to full speed.
Okay, lovely. Hope that's helped. Next question is from John. I had a blood clot in the superficial veins in the right leg last year after a long flight. It cleared up, but does that present any issues with the treatment?
No, not really. You might ask, why would that happen? And if you have a varicose vein and you sit in a car or in an airplane, you kind of crease your leg in two places, and that tends to fill your veins up. So it's interesting, varicose veins tend to reduce a little bit when you're walking. You get a type of siphon effect. But the two things that get them going are sitting, for example, in a car, or interestingly, cycling, because you're at a slight angle, and that slight angle preferentially shoves some blood up into the surface. So your veins, if you think of them as tiny little things the size of a shoelace, the ones that are on the surface should be really only the size of a thread. So if they're big, they've been stretched, and rather like a balloon stretching, they're not going to go pop, but they do eventually, the wall eventually starts to get damaged, and that produces a clot. So that's superficial thrombophlebitis. So superficial, it's up on the surface, thrombo is a clot, and phlebitis is inflammation of the vein. So that's one of the indications to have your veins done. So quite often that's the thing that precipitates someone coming to see me to sort out the rest of their veins.
Okay, I hope that was helpful for you, John. Next up is Patricia, and Patricia asks, I have a toe wound which is getting slowly better. Is it still possible to have the other leg treated while it's still healing?
Yes is the answer. The thing that I would always look for is to make sure that you're mobile. I don't want to give you two limbs that are giving you grief. So if you walk in and you're pretty mobile, I'm happy to do the other side. And the mobility thing is to make sure that you don't get a DVT. So if someone, for example, had a fractured ankle and had a big operation and was in a cast, I wouldn't dream of doing an operation on the left leg unless on the other leg, unless it was absolutely necessary. So it's all to do with being mobile, walking in and out, and that gets you back to normal quite quickly. So small wound on the toe, if you had your ingrown toenail done or something minor, that's no problem at all.
Okay, lovely. And we've got one more question. They say, thank you for your session. You're very welcome. I've had surgery on both legs in 1986, again in 1997 on one leg, and again in 98 on the other leg. I'm 72 now, and my legs are a dreadful mess, lumpy veins, and my feet and behind my knees are awful. Do you think I'm a lost cause, or is there any help to improve them?
Yeah, you'd be surprised. Sometimes if your first operation wasn't particularly good, or they didn't get all the veins, what often happens is you get recurrence and then more and more recurrences. And sometimes, especially before the use of ultrasound was routine, you kind of guessed what veins had recurred. So people have often had 3 or 4 useless operations, and then when they come, I scan them, and I show you when I scan you that quite often they still have a vein that's sitting there. It may have been tied off the groin, but it wasn't removed correctly. And sometimes you can do a remarkable amount with a laser on patients like that. I would say that if you have loads of small veins in your legs, what normally happens is I can reduce them, but rarely get rid of everything completely. So what I like is when people come to me with first-time veins, because I know they're fairly straightforward to sort. When they come as recurrent veins, or especially if you've had multiple previous operations, I'm usually very clear with you when I scan you whether I can fix you or not. Most times I can. It's very rare for me to say no. And I just try and give you a reasonable expectation of what to expect. So occasionally people come to me and they say, I just can't wear sandals. I've had multiple operations. My feet are a mess of little veins. And for those people, I quite often say, I can get rid of most things and make your legs feel good. I can stop the eczema, etc. But I cannot get rid of all the smaller veins to such an extent that you'd be happy wearing flip-flops. So I think it's very important that when I see you, give you a reasonable idea of what to expect. And I certainly don't over-advertise that, so because I don't want anyone to be unhappy afterwards. So I do manage your expectation, and I'm very clear with you on that, so that if I thought that wasn't going to work and there was no danger to you, I might say there's not much point in trying to do that if your whole thing is that you want to wear sandals. I hope that's kind of clear.
Lovely, sounds good. A late entrant question here. Is there a need to wear compression on the leg after the operation?
Not really. So I put a compression bandage on you, which is like soft Velcro, and that's because nobody wears compression stockings if they can avoid them. That's usually the thing you're given first of all when you go and see somebody told to wear compression stockings. I think it's ridiculous. Nobody ever wears them. And after operations in warm climates, absolutely nobody wears them. So I think there's a kind of a reflex that everyone should wear compression stockings. I just think that's just a UK thing. I don't think they work very well. They rarely fit. So I put a bandage myself on, which says like soft Velcro, and that's on for a few days. It varies between 3 days to maybe 5 or 6 days. And you take that off yourself, and essentially you leave everything open to the air. I think stockings are just a source of misery for most people. And very little benefit you. So they don't really prevent DVTs. What prevents DVTs or clots in the leg or gets you back to normal quickly is moving. So anything that stops you getting up and about, like a badly fitting compression stocking, is not particularly useful.
Okay, so I think that's a no for compression stockings. Thank you very much. So thank you everyone for your questions. As a thank you for joining this session, we're offering 50% off the value of an initial consultation. Just use the voucher code there when you contact us. A call back from your dedicated private patient advisor. You'll get an email tomorrow with a recording, treatment information and loyalty reward points, and also updates on news and future events. We'd also be really grateful if you complete the survey at the end of the session to help us shape our future webinars. If you'd like to discuss treatment further or to book your consultation, our private patient team will take your call until 8 p.m. this evening or between 8 a.m. and 6 p.m. Monday to Friday using the number on the screen. Our next webinar is on enlarged prostate treatment with Mr. Garnett, which you can sign up to via our website. So on behalf of Mr. Sweeney and our expert team at Bendon Hospital, I'd like to say thank you very much for joining us today, and we hope to hear from you very soon. Thank you very much.
Thanks.